If you're over 60, there's one small habit that could silently raise your risk of a stroke while you sleep. There's no warning, no pain. One moment you're perfectly fine, and the next, you wake up unable to move your arm, or worse, your speech is slurred and your balance is gone. It sounds terrifying, but unfortunately, this scenario happens far too often. Hi, I'm Dr. Thomas, a brain specialist who has seen this heartbreaking situation firsthand many times. What's shocking is that this isn't usually caused by smoking, poor diet, or lack of exercise, the usual suspects we often hear about. Instead, the hidden culprit is something most seniors trust and rely on every day: vitamins. Millions of older adults take supplements hoping to protect their bones, boost their energy, or keep their memory sharp. But here's the catch: while many vitamins do help, some, especially when taken in high doses or at the wrong time, can quietly increase the risk of stroke, brain bleeds, or nerve damage. These dangers often go unnoticed until it's too late. Before we dive deeper, I'd love to hear from you. Have you ever wondered if the vitamins you take could actually be doing more harm than good? If so, type 1 in the comments. If this is all new to you, type 0. And if brain health matters to you or someone you love, please like this video and subscribe to Health 365, where we share honest, science-backed tips made especially for older adults. Let's get started. Vitamin D is often hailed as a miracle vitamin, praised for its role in strengthening bones, boosting mood, and supporting the immune system. Many seniors take it daily, sometimes in high doses of 5,000 to 10,000 IU, believing it will protect them as they age. But here's the truth that most aren't told: taking too much vitamin D, especially at night, can quietly push your body towards serious danger. Let me share the story of Mr. Walter, a 74-year-old retired Navy veteran who was disciplined about his health and took his supplements religiously. Every morning, he took a 10,000 IU vitamin D capsule, thinking it was safeguarding his bones. What he didn't realize was that this high dose was slowly causing calcium to build up in his bloodstream. When excess calcium circulates unchecked, it can deposit in your arteries, making them stiff and narrow, a perfect setup for blood clots that can trigger a stroke. What makes nighttime dosing particularly risky is that during sleep, your body tends to become dehydrated, and blood pressure naturally drops. This combination with high calcium levels creates a perfect storm that can silently harm your arteries while you rest. Unfortunately, Mr. Walter's stroke happened overnight. His wife found him confused and unable to speak clearly, his right arm limp. His blood work revealed dangerously high calcium levels and stiff arteries caused by vitamin D toxicity. The key takeaway here is moderation and medical supervision. Most older adults do not need more than 2,000 IU of vitamin D daily unless a deficiency is diagnosed. It's crucial to get your blood levels checked regularly and avoid taking large doses without a doctor's guidance. Also, always take vitamin D supplements in the morning rather than before bedtime to reduce risks. If you're currently taking vitamin D, I encourage you to type D in the comments so we can open this important conversation. Your health matters, and understanding how to take vitamins safely can make all the difference. Vitamin E is often called the heart helper because of its reputation for supporting circulation and protecting the heart. Many seniors take it daily, hoping it will boost memory, improve skin health, and promote overall wellness. However, what most people don't realize is that vitamin E acts as a natural blood thinner. While this anticoagulant effect can be helpful in some cases, it becomes dangerous when combined with prescription blood thinners like warfarin, aspirin, or Plavix. Take the story of Mrs. Evelyn Brooks, an 81-year-old retired librarian who was on warfarin for a heart valve condition. Her doctors carefully monitored her blood work and blood pressure, and everything was stable. But when Evelyn started taking a high-dose vitamin E supplement, 800 IU per capsule, she unknowingly increased her risk. Just 3 weeks later, she was rushed to the emergency room with a severe headache, confusion, and vomiting. A brain scan revealed a hemorrhagic stroke, caused not by high blood pressure or a fall, but because her blood had become too thin to clot properly. This common mistake, stacking vitamin E with blood thinners, can quietly raise the risk of internal bleeding, especially in the brain, where even a small hemorrhage can have devastating effects. The recommended daily intake of vitamin E for older adults is only about 15 milligrams, or roughly 22 IU. Yet, many supplements on the market contain doses ranging from 200 to 1000 IU per capsule, far exceeding safe levels. For seniors, it's critical to be aware of how vitamin E interacts with other medications and to avoid high doses without medical supervision. Warning signs of vitamin E overdose can include headaches, confusion, and fatigue, symptoms that should never be ignored. If you're taking vitamin E or blood thinners, be sure to discuss your supplements with your doctor to keep your brain safe. Vitamin B6 is often promoted as a brain booster and nerve support vitamin, found in many supplements claiming to improve energy, focus, and memory. At first glance, it seems like a safe and helpful addition to any health routine. However, in high doses, vitamin B6 can become a silent nerve destroyer, causing serious and sometimes permanent damage. Let me introduce you to Mr. Harold Jenkins, a 76-year-old retired truck driver who came to my office complaining of numbness in his feet, tingling in his hands, and worsening balance. At first, Harold thought these symptoms were just part of getting older, maybe arthritis or even early dementia. But after a closer look at his supplements, the culprit was clear. He had been taking a nerve support formula containing 100 milligrams of vitamin B6 per tablet, 2 tablets a day, totaling 200 milligrams daily. That's more than 10 times the recommended safe upper limit for seniors. Unlike some vitamins that your body flushes out, vitamin B6 builds up slowly over time. In older adults, this accumulation can damage the protective coating around nerves, much like stripping the insulation off electrical wires. The result? Tingling, numbness, muscle weakness, tremors, and confusion. These symptoms often creep in gradually, making it easy to mistake the damage for normal aging or other health issues. Unfortunately, if not caught early, the nerve damage can become permanent. Many brain support and energy supplements contain 50 to 100 milligrams or more of vitamin B6, far exceeding what most seniors need, which is only about 2 to 10 milligrams daily, including what comes from food. The best way to prevent this hidden danger is to carefully check the labels of any nerve or brain supplements you take. If you see high amounts of vitamin B6, it's time to reconsider or talk to your doctor. Your nerves will thank you for it. Vitamin A is well known for its role in maintaining good eyesight and supporting the immune system. Many older adults take vitamin A supplements to help with skin health, eye function, or simply to age gracefully. But what most people don't realize is that vitamin A, being fat-soluble, can accumulate in the body over time, especially in the liver, brain, and other tissues, leading to serious health problems. A striking example is Ms. Dorothy Simmons, a 79-year-old retired piano teacher who began experiencing persistent headaches, dizziness, blurred vision, and eventually slurred speech. Her family feared she was having a stroke. But scans revealed something different. She was suffering from pseudotumor cerebri, a condition that mimics a brain tumor with increased pressure inside the skull. The cause? Vitamin A toxicity from a high-dose skin and eye health supplement she had been taking daily for over 5 years, with doses reaching 10,000 IU each day. Unlike water-soluble vitamins that your body can flush out, fat-soluble vitamins like A are stored, and as we age, our liver's ability to process and clear excess vitamin A slows down. This buildup can lead to increased intracranial pressure, causing headaches, vision problems, dizziness, nausea, and even permanent vision loss or cognitive decline if not addressed. The safe upper limit for vitamin A intake in older adults is roughly 2,500 to 3,000 IU per day, but many popular skin and eye formulas on the market contain doses between 5,000 and 10,000 IU, or even more. What makes it worse is when people unknowingly stack vitamin A by taking a multivitamin alongside these specialty supplements, multiplying their total daily intake far beyond safe levels. Ms. Dorothy is now on a long road of recovery, requiring regular eye exams, pressure checks, and balance therapy. Her story is a powerful reminder that even vitamins considered essential can become hidden threats if taken without caution. If you're taking vitamin A supplements, especially for skin or eye health, it's crucial to review your total intake and consult your healthcare provider. Niacin, also known as vitamin B3, is frequently promoted as a natural way to support heart health and lower cholesterol. Many older adults take niacin supplements or consume energy drinks fortified with this vitamin, hoping to protect their hearts and improve circulation. However, high doses of niacin can have dangerous side effects, especially for seniors, including sudden blood pressure fluctuations, flushing, arrhythmias, and even mini-strokes known as transient ischemic attacks (TIAs). Consider the case of Mr. Frank Miller, an 82-year-old retired postman from Florida. Frank began experiencing strange symptoms each morning: hot flashes across his face, pounding chest sensations, and bouts of dizziness that came and went without warning. Initially, his family and doctors suspected anxiety or medication side effects, but the true cause was hidden in plain sight. Frank had been taking an over-the-counter heart health supplement containing 1,000 milligrams of niacin per serving, twice daily, totaling 2,000 milligrams each day. This massive dose was quietly wreaking havoc on his cardiovascular system. One common misconception is that flush-free or extended-release niacin supplements are safer. Unfortunately, this isn't always true. Even these formulations can cause dangerous spikes and drops in blood pressure, trigger irregular heart rhythms, and negatively affect blood sugar levels. For seniors, doses above 50 milligrams daily should only be taken under strict medical supervision. It's essential to carefully check labels on all cholesterol support supplements, energy drinks, and fortified cereals for niacin content. What may seem like a harmless vitamin can silently place your brain and heart at risk if taken in excessive amounts. If you're using niacin supplements or products that contain it, speak with your healthcare provider to ensure your dosage is safe and appropriate for your health status. Instead of relying heavily on pills and supplements, one of the best things you can do for your brain and overall health is to shift your focus toward nutrient-dense, real foods. Our bodies are designed to absorb and use nutrients most effectively when they come in their natural form, balanced and in the right combinations. Whole foods provide a rich array of vitamins, minerals, antioxidants, and healthy fats that work together to protect your brain, support your heart, and maintain steady energy levels without the risks that come with megadoses in supplement form. Take Mrs. Margaret Wilson, a 73-year-old retired school principal from Arizona. When I first met her, she was taking 6 different supplements every day: vitamin D for bones, vitamin E for her heart, B-complex for energy, niacin for cholesterol, a multivitamin, and a few others for brain support. Despite doing everything right, she was struggling with dizziness, unstable blood pressure, and low energy. We decided to take a different approach, clearing out the clutter of pills and replacing them with simple, whole foods, eaten at the right times and in the right combinations. Her typical breakfast became a perfect example of brain-healthy nutrition: 1 boiled egg for clean protein, half an avocado loaded with healthy fats, a slice of whole grain toast for slow, steady energy, and a handful of blueberries rich in powerful antioxidants. She also made sure to drink a glass of room-temperature water first thing to hydrate her brain. Sometimes, she added a few walnuts or almonds for extra vitamin E and magnesium. Within just a few weeks, Mrs. Wilson noticed her dizziness faded, her blood pressure stabilized, and her mind felt clearer than it had in years. Foods like leafy greens, spinach and kale, are packed with folate and antioxidants that help fight inflammation and support cognitive function, Fatty fish such as salmon and sardines provide essential omega-3 fatty acids, which protect brain cells and support heart health. Berries offer polyphenols that reduce oxidative stress, while nuts and seeds supply vitamin E and magnesium, key players in brain health and nerve function. Whole grains help maintain stable blood sugar and promote healthy circulation, while adequate hydration ensures your brain cells function optimally. Eating real, nutrient-rich foods is not only safer but also more effective than megadoses of isolated vitamins. The balance found in nature prevents the toxic buildup seen with some supplements, reducing risks like artery stiffness, nerve damage, or brain pressure. When you nourish your body with these whole foods, you're not just filling a vitamin quota, you're giving your brain and body the tools they need to heal, thrive, and protect your independence as you age. Supplements aren't evil, far from it. They can be helpful when used correctly and under the guidance of a healthcare professional. But as we age, our bodies process pills very differently than they did when we were 30. What once might have been harmless, or even beneficial, can turn risky if taken without careful thought or regular monitoring. The most powerful tool you have is awareness. Don't just pop pills blindly hoping for the best. Take the time to understand what you're putting into your body, how it interacts with your medications, and how your body's needs change over time. This knowledge is your best medicine and the key to protecting your brain, your heart, and your independence. So, here's a question for you. What's one supplement you'll review or replace with real food starting tomorrow? Share your thoughts in the comments. Let's support each other on this journey towards safer, smarter health choices. Remember, you don't need to fear vitamins, but you do need to understand them. With that said, thanks for watching, and until next time.